To talk about the applications of DWI, it will help you understand acute influx, abscess, hematoma, epidermal cyst, and carbon monoxide poisoning. The details of the poisoning will be discussed later. Now, when you talk about the gradient echo and susceptibility weighted imaging. In this, these are blood sensitive sequences. It detects blood and calcification. The appearance of blood in case of trauma or stroke, the thing is, there are black spots in the brain parenchyma, which is called blooming, and that is the blood. If you closely observe this image, you can see some black spots, okay, in these images, and that is your blooming or the hemorrhage. So that is better understood in susceptibility weighted imaging. Then you have a sequence for capillary blood flow, that is perfusion weighted imaging. If you closely observe this image, you can see that the different amount of blood flow is getting different kind of a color. Now, if you have to understand MR angiography, it uses something called the time of flight. Using this, you can see the vessels without using contrast. The advantage is you don't need an RFT to get this done. You can directly ask the patient to go for an MR angio. Now, in this MR angiography, you can see that the anterior cerebral artery on the left side is not visible. It is suggestive of thrombosis in the anterior cerebral artery. Apart from that, you can see the middle cerebral artery, the internal carotid artery is clearly visible. There is something called the phase contrast MR angiography that will help you determine direction and velocity of the blood flow as well. If you talk about the MR venography, the application is for diagnosis of cerebral venous sinus thrombosis. So it helps you understand the sinuses better. The MR venography also does not require contrast. So MRI has a lot of advantages. If you see this, this is the sigmoid sinus. The anatomy is the most important here. This is a sigmoid sinus. Then you have the confluence of the sinuses. This is a transverse sinus. And then you have a straight sinus. And the straight sinus continues as the inferior sagittal sinus. And superiorly, you have the superior sagittal sinus. So this is the view from the lateral aspect. Then on the other MRI sequences, if you talk about functional MRI or blood oxygen level dependent MRI, based on the brain activity, there will be a change in the magnetic property of the brain which is detected in the imaging. If you talk about activities like speaking, it will increase